Great Britain's National Health Service unable to fulfill its most basic function. I'm not talking about medical care. I'm talking about feeding patients. Britain's Office for National Statistics just issued a chilling report. Over the last 4 years, 1,165 people in government hospitals starved to death. The chief reason cited for patient starvation is that nurses are too busy to feed them. In 2011, according to the UK Daily Mail, 334 people in British hospitals either starved to death or died in a state of severe malnutrition. Of those who managed to escape, 5,500 checked out of the hospital suffering from malnutrition. The details of individual cases are horrifying. Here's just one. A 43-year-old with Down syndrome hospitalized following a stroke. Unable to swallow, he required a feeding tube. It never came. And by the time government workers noticed, he was too weak to tolerate the feeding tube operation. 5 days later, he died in agony. Officials at some of these hospitals have resigned in the wake of this report. Diane Jeffrey, chairwoman of a malnutrition task force, states the obvious. Too many are paying the price with their lives while being deprived of the basic right to good nutrition, hydration, and support. Now, we thankfully don't have to worry. I'm sure the U.S. government's taking over more and more of the healthcare sector, and Obamacare spreading like a bad virus, but our government healthcare workers would never, ever let people starve. Would they?